Hello everyone, this is Manish Takur from Group 2A representing topic fatty liver. Here is a picture of fatty liver and a healthy liver. Fatty liver is generally a condition where fat builds up in the liver. Talking about etiology, fatty changes in the liver may result from one of the two type of causes. First one, condition with excess fat. These are the conditions in which the capacity of liver to metabolize fat is exceeded because of obesity, diabetes mellitus and congenital hyperlipidemia. Second one is liver cell damage. These are the conditions in which fat cannot be metabolized due to liver cell injury as follows. First one, alcoholic liver disease, that is the most common. Starvation, protein calorie malnutrition, Ray's syndrome, hepatotoxins, CCl4, chloroform ether and other poisons. Talking of symptoms, mainly weight loss, fatigue, tiredness, pain in the upper side of the abdomen. And coming to pathogenesis, mechanism of fatty liver depends upon the stage at which the etiologic agent acts in the normal fat transport and metabolism. Hence, the pathogenesis of fatty liver is best understood in the light of normal fat metabolism in liver. Lipid as free fatty acid enter the liver cell from either of the following sources. First one, from diet as chylomicrons containing triglycerides and phospholipids, or as free fatty acids from adipose tissues as well. Here it is a graphical representation. Free fatty acids we get from diet or adipose tissues and from acetate also, and these free fatty acids are further converted into triglycerides in the presence of alpha glycerophosphate, and triglycerides further converted into lipoprotein in the presence of lipid acceptor protein, and these are distributed as plasma lipoproteins into the bloods. And here is a picture of healthy liver progressing to fatty liver, then liver fibrosis and ultimately liver cirrhosis. Now we're talking about causes of fatty liver. As we talked earlier, factors contributing to increased TAG synthesis, triacylglycerol synthesis, that are high fat diet, diabetes mellitus and starvation. They mainly increase free fatty acids that ultimately increases TAG, and other are factor causing reduced utilization and removal of fats are chronic alcoholisms, and factors contributed to decreased VLDL synthesis or secretions are mainly two: decreased VLDL synthesis or decreased VLDL secretion. Firstly, decreased VLDL synthesis, mainly because of decreased apoproteins synthesis, that is mainly because of protein energy malnutritions where required amino acids are not available. Others include hepatic injury due to hepatitis B, CCl4, carbon tetrachloride, arsenic, lead, ethylene, etc. And decreased VLDL secretion is mainly due to decreased lipotropic factors, which includes choline, inositol, methionine, selenium, vitamin E and omega-3 fatty acids. And these lipotropic factors play active role in the removal of fats from the liver by different mechanisms, thus preventing the risk of developing fatty liver. And these lipotropic factors prevent fatty liver but cannot reverse the conditions, things to be noted. And further, coming to the diagnosis of fatty liver, techniques to diagnose fatty liver are blood test, ultrasound, liver biopsy. In blood tests, certain liver enzymes might be treated which may be higher than normal. Presence of higher level of such enzymes may denote fatty liver. Ultrasounds Fatty liver may be found of seeing the image of liver in ultrasound. The fat in the liver will be seen as white area, and in biopsy a needle will be inserted into the liver and a tissue will be taken out for certain tests. And talking about gold standard, histology or liver biopsy stands as gold standard for diagnostic tests of fatty liver. Others include imaging, ultrasound, MRI, CT scan, and these results are variable and not well verified. Also the costs are very high, less availability, and insensitive unless steatosis is less than 33% operator dependent. Coming to risk factors of fatty liver, certain risk factors that include being obese or having type 2 diabetes, malnutrition, excessive alcohol use, high cholesterol, high triglyceride level, taking excess dose of certain medicines like methotrexate, amiodarone, diltiazem, mainly antiarrhythmic drugs. Or coming to treatment, there is no certain treatment of fatty liver. Preventing the risk factors such as losing weight, quitting alcohol, managing cholesterol and sugar level, and eating a healthy and balanced diet can help to reduce fatty liver. And as we mentioned earlier, losing weight, regular exercise, eating healthy food, avoiding carbonated drinks, avoiding eating fried or high fat food, and considering nutritional supplements can help regain a healthy liver. And that's it. Thank you. Good day.